Okay, it's easy to jump the anterior crossbite. Now, the question is, when you take a lateral set and the patient has significant COCL discrepancy, do not take it in centric occlusion because it's a forced reading. Because the mandible protruded forward and upward. Alright? Okay, so you need to take it end to end. And then use an acid paper to rotate your mandible upward. Then you can do the measurement. Alright? So here is the diagnosis. And then you need to figure out the treatment strategy. Alright? Now Dr. Willis is very good because he has all different design of his appliance. Alright? A strategy. So now we don't have mini screw to help out. So what would be your strategy? By the way, I don't know what is the Vietnamese translation. That word strategy is very, very important because it's how efficient can you move the maxilla or the upper jaw forward. How efficient, right? When you go to the airport, there are different ways, right? You can take a helicopter and go to the airport, but it's not very efficient, okay, for that reason. But there are at least 3 ways if you want to move the upper jaw forward faster, okay? Number 1, you protract the maxilla along the center of resistance of the maxilla, along the center of resistance, because in that case, you don't tip the maxilla, you translate the maxilla forward. Okay, I will show it to you. Second, you may want to use Dr. Eric Liu. Expansion, constriction, expansion, constriction, expansion, constriction, to basically distract the maxillary suture. Distract. That means loosen up the maxillary suture. Then it will move faster, right? And the third thing is, you might want to use a combination of face mask at night and then class 3 elastics during the daytime. Okay, I repeat. Face mask, which is orthopedic, 16 ounces on each side, all right, or 600 grams, all right? But during the daytime, you need to supplement with class 3 elastic, which is only 3 to 5 ounces, but it's necessary. I will show you why, all right? And then finally, overcorrection, all right? Because you are anticipating future disharmony of growth between the upper and lower jaw. Alright? So those are the 4 strategies. So now I'm going to illustrate that with Victoria. Alright? First of all, why do you want to translate the maxilla forward? Alright? And the center resistance of the maxilla is actually between the Frankfurt horizontal, which is underneath the eyeball, and the occlusal plane of the upper first molar. Alright, in between. Alright? So if you protract the maxilla below the center of resistance, then you're going to tip the maxilla. Alright? So don't do that. Alright? And I will show you how, one way, you can protract the maxilla along the center of resistance, okay? And there is publication that you should protract it in the canine area from 30 and 40 degrees below the occlusal plane or the Frankfurt horizontal. 30 or 40 degrees in the canine area, not in the molar area, right? So then it will be protracted along the center of resistance of the maxilla, alright? So then here's the face mask, here's the rubber band, which is forward and downward, and take a look at the 2 wires shorter to the first molar. They were extended to the canine area, okay? So 30 degrees down and extend it to the canine area. Now you can protract the maxilla along the center resistance of the maxilla. Alright? So this is Dr. Eric Liu, the expansion, construction protocol. So it's 7 weeks. Now, if I don't do it, is that okay? Yeah, of course it's okay. But it will take you 1 year to protract or jump the anterior crossbite. Alright, but it only takes me 4 months, okay, to jump the anterior crossbite if you use. So what age should I start using expansion constriction? Any patients over 8 years old. Any patient over 8 years old. Now, 5-year-old, you don't need to do it because why? The sutures are wide open. Right? 8 years old, 9 years old, 10 years old, 11 years old. Expansion, constriction, expansion, constriction. Now, I'm going to try to show you a movie, alright? So if you do it for 7 weeks and you grab the maxilla, it's actually loose. Alright, if you like to play around with that, alright, check it out. In a mixed dentition, if you've gone through 7 weeks of expansion, constriction, that is how loose the maxilla is. And now how you started protracting, it's going to move faster. Alright? Now, then the third strategy is at night you put the face mask which is on that hook in the canine area. Right? But during the day, you must supplement with class 3 elastic, which is only about 3 ounces. Alright? So what happened is at night, the maxilla came forward. During the daytime, the elastic hold it. So forward, hold it. Forward, hold it. Forward, hold it. Right? So that is how you'll be successful. So in 3 months, we jump the anterior crossbite. Right? Now some people ask, hey, why can't I just tip the upper incisors forward and jump the anterior crossbite? Why? Because the inclination of the upper incisors is already in normal position. So you want to move the whole maxilla forward instead of tipping the upper incisors forward. Alright? So if you can, go ahead and overcorrect the overjet to excess overjet of at least 3 millimeters. Alright? So right now the patient is 9 years old. Alright? So you can see the profile actually improved at 9 years old, just because it's only less than 1 year treatment, right? Then the next thing, which is testing your patient, is you're not supposed to touch the patient until what age? What age? Is a girl. What age did I say that before you can put braces back on again? No, 17 is for boys. What about 14? Alright, so 9 years old, you check the crossbite, okay, in profile, improve, the maxilla is in very good position. Here is 12 years old. By the way, sometimes I'm a little scared of seeing this patient because if the mandible grows too fast, the patient is going to come back with an anterior crossbite. So what would be the best way to check if the jaw are growing in harmony? It's the overbite. Alright? If the lower jaw growing faster than the upper jaw, your overbite is going to decrease. Alright? So this girl right now is 12 years old. No more braces, right? So are you going to stop here or are you going to continue seeing this patient? Are you going to stop here or are you going to continue seeing this patient? Continue to see until what age again? It's a girl. 14 years old, okay? So here is the girl at 12 years old, looking pretty good. Here is 14 years old, alright? So, is the patient still class 3? Yeah, it is still class 3. Look, the lower incisors tip back, right? So the question is, are you going to do jaw surgery on her? think so. Okay. So that is when, at age 14 for a girl, you have to make the decision: surgery or no surgery. All right. You take a look at her, 14 years old for a girl, because there's not going to be any significant change from that point onward. So you can tell the parents, surgery or no surgery. Okay? So that is the benefit of early treatment. Right? So you take advantage in the mixed dentition 7-11 when the sutures are still loose. Alright? Okay, now, second question. What if I don't use expansion appliance? Alright? I cannot use the hybrid Hybrax in a mixed dentition, okay? If there is no expansion appliance for that reason, right? So what should I use? Okay, then I ask ChatGPT. How many of you use ChatGPT? Raise your hand. Yeah, you use it for what? Taking exam? I'm just kidding. All right. So here is Cambry. All right, 8 years old, 7, 11. All right. So now, by the way, the green line is Dr. Larry Andrews' aesthetic line. All right. If the upper incisors did not touch that green line, look at this. The upper incisors is way behind that line. So what does that mean? She's ugly. You're supposed to laugh, okay? She's ugly. Right, you're supposed to laugh, okay? Yeah, it was a joke, okay? So she has maxillary deficiency, all right? Okay, now if you take a look at the bite, here's the anterior crossbite, all right? So what's the second thing that you should check? What's the second thing? Oh, you are wearing this, okay? I'm going to ask somebody who did not wear one of this, okay? What is the second thing? That's right. You check for CO-CR discrepancy, right? Okay? So, but that's... And also, if you do an intraoral scan, all right? Then you can check if the width in the anterior and the posterior match or not. That means intermolar and intercanine. You got to check both. Because sometimes intercanine width is narrow, sometimes intermolar width is narrow. Okay? So this particular patient, intermolar is okay, but intercanine is a little bit deficient. That's why. Okay? There is crowding on the upper arch. Okay? So Panorax OPGs have no problem, all right? So here's the diagnosis. By the way, is this a dental class 3 or is it a skeletal class 3? Let's see who's not wearing one. Ha ha, you are not wearing it. Ha ha. Is it a dental class 3 or is it skeletal class 3? Dental. Everybody agree? It's a dental class 3, right? So how are you going to treat this? Patient said, I don't want expansion of life. So how are you going to treat this patient? Any suggestion? Huh? Are you going to use brackets or no brackets? No brackets. So you're going to use clear aligners? No. So she just want to have a bite plane and tip the upper incisors forward, right? You can do that. Anybody who want to use aligners to treat this case, raise your hand. Oh, have you ever done that? You have done that. Is it successful? Now you guys better go to this guy over here, all right? So he has used it. I'm going to show it to you how I did it, all right? So, yeah, I have a biplane, all right? But that's not to jump the anterior crossbite because I'm going to be using clear aligners, all right? So here is the clean check, okay? I want you guys to see the increase in width. All right. So let me see if I go back. Okay, and maybe I cannot go back. Okay, now here we go again. All right. Now take a look at the. You see the increase in the width. All right. So altogether is 16 aligners. Okay. So you jump the anterior crossbite. All right, and you also basically correct the width. Okay. So here is conically aligner number 3, and I added on a face mask, which is kind of cool, okay? Because this particular company has a button, they call it angel button or angel hook. You can put it in there for nighttime connecting to the face mask, and then daytime class 3 elastics. Isn't it cool? You know, just add a few buttons in there. You can try it, right? So does it work? Check it out. Okay, so nighttime and then daytime elastic. So 7 weeks, okay, now each aligner just 1 week, all right? You don't need to go 10 days or 2 weeks. Just 1 week, all right? So 10 aligners, all right, that's how she looks like. All right, 10 weeks. You already jumped the anterior crossbite, you know, in 10 weeks. All right, so you check the occlusion. All right, okay, now let's go back a little bit first, okay? So the question is, how many millimeters did I get for expansion? Interesting, all right? So hold that a thought, okay? So my question to you, especially, by the way, who are the students here? Raise your hand. Who are the orthodontic students? All right? There are 2. There are only 2. Is anybody over here a resident, orthodontic resident? All right? Okay, the resident. How many millimeters, if you want to do some research, how many millimeters do you think we can get expansion out of clear aligners? How many? Well, I mean, you are too smart, you know, you already asked a different question. And obviously, I only have the model, so it's a combination of skeletal and dental expansion, right? So how many meters? Give me a number. 6? Oh, see, these students are smart. 6 millimeters. That's not too bad, right? Now, before I tell you the result, okay, I want to give you another patient because, I mean, there's no way that you treat one patient and you said that, oh yeah, it works, right? So, and then the last one is, you said is dental, class 3, right? Take a look at this, okay, patient. Now, Patricia, all right? She has also anterior crossbite, posterior crossbite, but she also has another problem. So, what's the problem? Missing teeth. How many teeth are missing? 2 lateral incisors. Is there anything missing? Why is the lower first molar fully erupted and the upper molar is 2 upper molar and 2 upper lateral incisors, alright? Okay, so I mean I have to show you some numbers because just to convince you that this is not a dental class 3, okay? This is sort of like a skeletal class 3 for that because of the width, because of the A and B, alright? So now, here is the problems. So the strategy, yeah, so I'm going to use the same thing, right? Clear aligners, because the patient doesn't want expansion of line. It's just the hygiene is not so good, all right? So, and we're going to do the same thing now. Watch how much expansion, okay? The student back there, okay? Watch and tell me if you hold the whole one to 6 millimeters. Now, so you're going to do arch development, okay, to make space for the lateral incisors, all right? So, I mean, you are pulling the clear aligners with 16 ounces of force on each side. Okay? So the question is, how are you going to make sure that there is enough retention of that appliance? So obviously, there are two things you can do. One is to increase the trim line. Alright, you understand what the trim line means? How much it covers all the way to the gingiva. Alright, so don't stop at the gingival margin, okay? Go further up, okay, so you get some. Because we are going to do protraction and also class 3 elastics during the daytime. So this is Patricia, okay? So it takes 23 aligners, okay? So we jump the anterior crossbite, we open up the space for lateral incisor, and the posterior teeth obviously need a little bit of settling for that reason, alright? Now, I only have 60 minutes left, because I'm supposed to talk about tabs or mini screw like Dr. Webb, right? I have to, because otherwise this conference is about mini screws, right? So, for patients who are in permanent dentition. So let's say you missed the golden period, which is 7, 11, right? You missed that, right? And you have the sutures that you need to go against, which is the zygomatic buttress, the cheekbone, okay? Alright? The pterygoid plates back there, and also the nose area, which we call piriform. Okay, so those are the areas that I'm going to start talking about that might be appliance. So Dr. Wims will continue this afternoon for that. All right. So by the way, 2025, there is a consensus. Go out to 26 experts in orthopedics, and they all agree. They all agree. If you want a more efficient orthopedic treatment, it would be best to do it with pads. Right, Dr. Wins? You agree? Yes. Okay, so that is if you want a sign, okay? So you can do that, all right? Now, I'm going to move on. So I'm going to show you one last patient. Now, 13-year-old boy, right? It already passed the golden time, 7-11. Early permanent dentition. Right? So, again, he doesn't look very good because his upper incisors is behind the green line, right? So you need to move it forward for that reason, at least for the aesthetic part of it, right? But this is how his bite is like. Now, if you take a look at the upper arch, there is no space for the canine, correct? Look, you got the first bicuspid right next to the lateral incisor, all right? So you have severe crowding in the upper arch, and you got the anterior crossbite. So let me ask the student at the back here, okay, sorry, I will keep bothering you. Extract or not to extract? So she shakes her head. When are you going to make that decision? Extract or not to extract? Until when? No, 13 years old. It's a boy. It's a boy. 18 years old, you will make that decision. Are you kidding me? So you're going to have him wait 5 years? Because you have growth to consider, right? It's class 3. That's number 1. Number 2 is your width is not done yet, right? The width, you don't know how much space, because every millimeter you expand, you can get 0.7 millimeter of space, right? But you have to expand a lot because he's got 8 millimeters deficient just on one side, all right? So it's a tricky situation, all right? And of course, so if you cannot use convention expansion appliance because he's already past 7-11 for that reason, all right? So what are you going to do? Okay, there's no teeth missing, all right? But take a look at the third molars at the back. I mean, this is fighting the second and third molar. They're fighting to come in. It's kind of like you're the mother, you're pregnant, there's a pair of twins. Who's going to come out first? By the way, that's a joke, okay? You're supposed to laugh, okay? There's a pregnant mother and a pair of twins. Who's going to come out first? Depending on when the baby is Asian or not, right? Or Vietnamese or not for that, because you guys are a little bit more courteous. Okay, for that reason, okay? Alright, so you did your psychometric analysis. He does have some skeletal problem, okay? And now, the reason I want to show you this case is not its perfect case, alright? There is a problem there, okay? Take a look at the design of this appliance. First of all, I used the Rollo band, which is good. It reinforces the molar bending, okay, so it won't break. But I'm supposed to extend it to the canine area, right? But I extended on the palatal side because the upper canines are erupting on the outside. But biomechanically, that will be below the center of resistance. So you're going to have some bite opening. So this is a MAPI appliance, okay? And you're going to be putting 4 screws in there for bony anchorage support, right? So we're going to go ahead and expand, okay? And you can see some tissue reaction to the MSC appliance for that reason, all right? So, but don't worry, okay? Because there are people who are allergic to nickel for that reason. So we're going to go ahead and expand, all right? And you're going to see the students over there, if there is enough room for accommodating the 2 canines and so the premolar at the back there, okay? So it turns out, okay, that we were successful, all right? As far as getting enough space but you can see the difference in the arch form, the upper arch and the lower arch, all right? So in this case, we are lucky that we don't need to take out any teeth, okay? And the teeth basically looks parallel, and also his upper incisors right now is closer to the green line, so it actually looks better for that reason, all right? Now, I only have about 21 seconds left, okay? Is it 10 minutes or is it, do I have 10 minutes? Okay, all right. So, one last question. What if your patient does not want to wear the face mask? See, you understand English, okay? What if the patient does not want to wear the face mask? And this little boy also have maxillary deficiency, right? Both the width and the anterior posterior. What would you do? Are you going to use clear aligners? Well, he's 12 years old. He's past what? 7, 11. So that's not good, okay? Clear aligner is not good. So what are you going to do? You're going to refer to your friend. The functional appliance, what are you talking about? FAO3 or what kind of functional appliance? The what? Activator. Followed by what? Fixed appliance. Okay. Are there any other suggestions? Well, by the way, you need to protract the maxilla forward and the patient doesn't want a face mask. So what do you do? Alright? I mean, look at the upper arch. It's so narrow in the intercanine area. Alright? The lower arch is very oval, right? And then there's one more problem. Alright? Not about how the teeth fit, but you know, it would be nice if you have a few more teeth. Alright? If you want to protract the maxilla, you gotta have teeth for that reason, right? So you don't have enough teeth and you don't want to wear the face mask. It's a problem, okay? So, what are we gonna do? Well, you're gonna take X-ray. Whoa, the width is minus 13. Is it minus 13 the width? By the way, the normal width is 0 or minus 1, right? So is it good, bad, or is it ugly? Huh? Good, bad, or is it ugly? See, I think I lost it. Okay. Bad means that you can camouflage by orthodontic movement. Ugly means that you're going to need surgery. Is it good, bad, or is it ugly? She thinks it's ugly. You think it's ugly? Anybody think that it is good? Raise your hand. Yeah, hopefully it's not the student right there. Now, by the way, the student, is it good, bad, or is it ugly? It's kind of ugly, right? Okay, so here's the diagnosis, okay? Oligodontia, right? And castrate skeletal problem, maxillary deficient, and congenital missing teeth. So here is some option. By the way, this is not strategy. This is an option, all right? Surgery first, right? Because it's class 3. The second thing is maxillary expansion with MAPI with face mask, but patient decline face mask, so that's no good, all right? And the bullet plates. Okay, with class 3 elastics, we call it the band, all right? By the way, you guys heard of Hugo the Clock? Anybody heard of Hugo the Clock? Raise your hand. Well, he's the one who talked about the bullet plates, all right? But the problem is the plates has to be in the lower area, and it's very, very traumatic. Okay, to put a plate on the upper, put a plate on the lower, right? Then final thing is micro-implant assisted maxillary protraction. So you can maybe do class 3 elastics full time instead of a face mask, but you gotta have a bony plate on the upper, you gotta have a bony plate on the lower, alright? So, what are the options that you can do? Well, you can do something like that, right? So basically, this patient have edentulous area, so you can actually put a few mini screws on the lower, and you also can put some sort of a MAPI appliance on the upper, but the patient only wears castrate elastics and 24 hours. Alright? It would not work, okay, if the patient only want to wear it about 12 hours, 14 hours, because you don't have the face mask. Alright? But you'll be amazed. You actually don't need 16 ounces of force, because those are called heavy intermittent force. Alright? So patients wear the face mask at night for about 12 hours, 10 hours, and 16 ounces on each side. But you can offer the patient alternative. Alright? You wear it for 24 hours and you don't need to wear the face mask. Alright? So that's what we offer for this patient. So those are the plates that you put down in the edentulous area. All right. So you're going to protract. So we reduce it from minus 13 to about minus 6.5, and then you basically put prosthetic teeth until the patient's finished growth, because the patient is only like about 14, 15 years old, and then you can put on prosthesis to replace it. All right, so you can see. I mean, the reason I want to show you this is there are orthopedic effect with just elastics. Very interesting, right? So that would be probably one option you can do. But you can also see this particular boy, look at that. He's got growth during the treatment. So if you don't have anything orthopedic in there or have orthopedic in nature, you're not going to make it. Alright? So, the final slide I want to show you is there is always the dark side about using mini screws, right? It's not like it's totally problem-free, alright? And you definitely have some inflammation, you got tooth discoloration, you can have a appliance break, asymmetric expansion, alright? How do orthodontists take care of asymmetric expansion? You camouflage it with orthodontic tooth movement. But inside, when you do expansion, they are not always. About 60%, okay, is symmetric, about 40% asymmetric. So we still consider that to be kind of like a side effect. So if you want to read a little bit about it, be my guest, okay? So I'm going to conclude my lecture because I answered 3 questions. The golden time for doing maxillary protraction, if the patient wear the face mask, 7-11, all right? If the patient doesn't want an expansion appliance, you can choose. Now, 7-11, I'm not talking about a 13-year-old, okay? You can choose to have clear aligners with the buttons already, and also design your appliance to have maximum retention while the patient is wearing it. That means you still have to put attachment in the primary molars, okay? Remember, if mixed dentition, you put attachment on the primary molars, you have to etch longer, okay? Etch longer, otherwise they will stick, all right? And then the final question I answer is, what if you miss, okay, the golden age of 7-11, then obviously you're going to stick with the MAPI appliance. So in general, in my clinic, any young patients above 11 or 12 years old, I will go ahead and put MAPI, even just for expansion, right? Because if you think about it, okay, if it is your children, would you want the upper molars to tip out? Alright? Because every time you tip it out and it's upright, you're going to lose buccal bone. Alright? You compromise the periodontal situation. So if you're not going to do it for yourself or your children, your own children, don't do it for other patients. Okay? And it's not so scary because Dr. Wim's going to show you putting MAPI appliance in patient is a piece of cake. You just have to get over that hump, okay? Then you'll be a lot more successful because your expansion is going to be more stable. Okay, thank you everybody for your kind attention.